So welcome and thank you everybody for joining us this brisk morning here. Everybody who's in person, appreciate you coming out today and also via Zoom. And just as a reminder, we are also live streaming as well. Marty, can you please make the announcement for interpretation services for those online?
Of course.
Marty, are we good?
Yes, sorry. Just a reminder to everyone on the Zoom interpretation option, there should be a little globe icon at the bottom of your screen. It is defaulted to off. Please select the audio channel to hear translation in Spanish. You can also select the audio to remove it from the background as you hear the Spanish translated audio.
Great. So as we're going ahead and getting started here, I do want to acknowledge and thank, Chief of Staff from Supervisor Church's office, Marilyn, for joining us today, and also Jonathan. It's great to see our partners in the room and representatives from our elected as well.
No, from the Salina Soccer Complex.
Soccer complex. Jonathan's from. I don't know who's online. I'm not connected to the Zoom. Do we have any electeds joining online?
We have Melanie from Supervisor Church's office, but nobody from Supervisor office.
Not yet. Maybe we'll keep an eye out as well. We are also live streaming, so folks may be joining via live stream and viewing it, and just not joining through the Zoom hybrid link. So thank you all again for being here, and a few housekeeping items as we get started. And I've been asked to talk a little slower as we go through these things so that we allow for the interpretation. So the restrooms, for those of you who are here in person, are right outside and to the left, right outside of the room. We also have some water and snacks available, so please feel free to help yourself. You will find the boards with the blow-ups of the draft renderings right outside the room, and you're welcome to view that at your leisure. And we will also be walking through those again here today. There is also a sign-in sheet, and we invite everyone to sign in. If you'd like to, and if you'd like to join the, and if you would like to join the email distribution list to receive updates on the project, there's a way to indicate that on the sign-in sheet, so we can also send you out any project updates. For those of you who are joining us by Zoom, we also invite you to drop your information into the chat so we know who's here today. And also please feel free to share your email. If you'd like to be added to our distribution list, we can go ahead and do that, and our team can make a note of that. We will have staff monitoring the chat and the Q&A. So please feel free to use those features if you are joining us by Zoom. We have some handouts here available for those who are in person, and this presentation will be posted to our website as well as dropped into the chat at the end for those who are joining remotely. So today we have allotted 2 hours for this listening session, and our plan this morning is to spend the first about 15-20 minutes providing the general overview of the proposed project, reviewing some draft renderings to help illustrate the project so folks can better understand what is being proposed and what it could look like. Realize we have folks who might be joining us for the first time today, so we want to make sure that we walk through everything. So for those of you that have been joined us before, thank you for your patience, for hearing the information for perhaps the second or third time. Appreciate you being here. Then we just really want to turn it over to hear what questions you have, your thoughts, any feedback that you have for us. And we will be summarizing the feedback we've heard thus far so that you're knowing what we're hearing and that there is an opportunity to use this session to clarify or add to any of the feedback that we've already received. So to help ensure that everyone has an opportunity to speak, if they would like, whether they're in person or via Zoom, we've set up the podium here in the room, and we plan to rotate between comments in the room and comments on Zoom, allotting 3 minutes per comment. So please, the use of the mic is really important to ensure that everyone who is joining us remotely, whether it's on Zoom or through the live stream feed, can hear the conversation in the room. So if you'd like to make a comment when we get to that point, we are going to ask that you please move to the podium, and or if you're on Zoom, please use the raised hand feature via Zoom, and then we will alternate between a comment in room and comment on Zoom to make sure that we're lifting up everybody's voice today. We would like to enable the recording, again, for our team's internal use only, to help ensure that we are accurately capturing all the comments, questions, and feedback that is being provided. And we will be compiling all of that information from all of the sessions to bring that information back to the Board of Supervisors. In the mailers that went out, it indicated that that meeting was going to be on Tuesday, December 9th. However, late yesterday, that has been taken off of the agenda for Tuesday and will now be on the agenda for Tuesday, January 6th. Okay. We received that notice late yesterday, so we will make sure that that gets updated to the version of the handouts that are being posted online. The ones here in the room may still reflect the December 9th date because those copies were made before that change was announced. So is there any objection to this being recorded for our staff's note-taking purposes only? Any objections in the room or online?
Can I ask you a question about something you just announced?
Yes, ma'am.
Yeah, okay. So you said it was no longer going to be.
The mic, please.
Of course. Margaret Benetti. You just announced, and on the news, they announced that no longer will it be presented in front of the county board on Tuesday. It's been moved to January 6th.
Correct.
I'd like to know why staff pulled it from Tuesdays. What is the problem happening here that staff pulled it?
So to
I
clarify,
understand
we
there-
did not pull that.
It was not pulled by staff. It was pulled at the request of the chair of the board.
Okay, so the staff of the county pulled it, not
Not-
your staff.
Correct, not health department staff.
Thank you.
So if there's no objection to the recording being enabled, okay, let's go ahead and start the recording then, Marty, please. And we're going to go ahead and get started. My name is Melanie Rhodes. I'm the Behavioral Health Bureau Chief, and with me today is...
Good morning. I'm Elsa Jimenez, and I'm the director of the health department.
And good morning, everybody. My name is Fabricio Chombo, and I am the Assistant Bureau Chief for our Behavioral Health Bureau.
And back to Elsa to go ahead and kick us off.
Great. Well, thank you, everybody, for being here. We do have some chairs up front if you'd like to move up to the front in the room. Thank you. Thank you again for joining us. If this is your first time, welcome. If this is your second or third time, we appreciate you coming back. Yes? So the microphones are not for the room. If I need to speak louder, just let me know. The microphones are for those that are joining via Zoom or YouTube or another means. Am I loud enough? Okay. Yes.
What is the Zoom website? I clicked at the paperwork, it's not on there. Do you have the Zoom? Someone's asking me online. Yeah, is it on the health department website somewhere? So go to the health.
Well, can we project it on the screen right now real quick?
Not on Zoom, they can't see it.
So the Zoom information, the Zoom information went out on the community listening flyers that were mailed out. It's also posted on our behavioral health website.
And it's on our website, which is,
I get blocks from here. I never got any flyer or any notification at all.
so we'll get into the notifications that we've done through the presentation.
Okay, our website, it is www.mtyhd
MTY.
HD, H
Yes.
as in health, D as in department, .org /MHRC.
/MHRC.
Yep. And then if you need the meeting number for the Zoom meeting, it is 954.
No, no dot.
No, there is, so it's after HD, there is a .org /MHRC.
May I have your phone? Oh, okay.
We tried that, they can't do it.
Sorry for the.
Okay, no one does.
A ver.
www.mty.
Put the Zoom meeting number, if you have that, you can find it. Someone online is asking, they can't find anything.
Yeah.
Well, we got the Zoom meeting number, we could tell.
The other one, the other slash
The other way. This way?
MHRC. H.
There?
Yep.
Okay, and what's the meeting ID?
Yep. And then, yes, the Zoom meeting ID, I'll go really slow. It is 954-72-806-788.
Por nada. Okay, so I will try to maintain a constant tone when I speak for the people in the room and also those of you joining us online. We thank you for spending a couple hours of your Saturday morning with us today. So why we're here today, this is our third community session where we are providing some details on proposed plans for building a mental health rehabilitation center. So we want to give you an overview on our project. We want to go over the benefits and challenges of bringing this type of service into our community. We want to share with you some preliminary draft design so you get a look and feel of what this would look like, because right now it is just a vacant parcel. And more importantly, we want to hear your thoughts and feedbacks on the project. We'll answer questions as they arise, and more importantly, we want to make sure that we continue to work with our stakeholders, our partners, the community, and more importantly, our clients to make sure that we have the services available that are needed when they need them in our community.
So can we get our IT folks to pull up the presentation again, please? Thank you. So thank you, Elsa, for talking about why we are here. And, you know, what is an MHRC? This is the formal Department of Healthcare Services definition of what an MHRC is. However, I really would invite folks to think about mental health services. I kind of want to take a step back just to level set, because folks might have a different understanding of the types of services and support and really what county behavioral health's mandate and responsibility is, and who we're required to serve. If you think about mental health care on a continuum and mental health needs on a continuum from mild to moderate to severe and chronic conditions, really invite you to think about that, because county behavioral health exists, and our responsibility for county behavioral health across the state is to provide a continuum of services for those with the severe chronic end of that continuum. The managed care plan, which here in Monterey County is Central California Alliance for Health, also known as CCAH, provides that mild to moderate continuum. And again, this is for Medi-Cal beneficiaries and the safety net population. So that is our responsibility, is that severe end of the continuum. So if you bear with me for a minute, if you try to think of equating that to primary care, if I go out and I play tennis and I blow out my knee, I might initially go to my primary care doctor saying, hey, I'm having some problems with my knee. And they might see me, and then they might refer me to a specialist or an orthopedist, right? And so that specialist would then further diagnose or treat, or even maybe I need surgery on my knee, and I'm referred to more specialty care. So using that analogy, CCAH, or the managed care plan, focuses on serving those with mild to moderate mental health conditions, and the county behavioral health, in that analogy, would be the specialist. So serving those with severe chronic conditions, as well as our substance use treatment continuum, again, for the Medi-Cal beneficiaries and the safety net population. And so when we're thinking about where does a mental health rehabilitation center level of care fit in to that continuum of services from, outpatient or acute inpatient, mental health rehabilitation centers are really like that subacute level of care, right? So it's more than your typical outpatient services or intensive outpatient services, and it's less than an acute inpatient hospital care like Natividad has. Okay, so I just wanted to kind of provide that frame. The mental health rehabilitation centers are designed to serve those 18 and older, so our transitional age youth population and adults, older adults, who are under a court-appointed LPS, or Lanterman Petra Short Act conservatorship, which is a civil conservatorship. This is not a criminal process. This is a civil process. And these are folks who are under a conservatorship for what's considered grave disability. So they're struggling to attend to their basic needs and maintain it in the community. And so they are in need of some intensive treatment and support for serious mental illness and or co-occurring substance use disorder conditions or other co-occurring conditions, be that a traumatic brain injury or trauma, PTSD, or other comorbid medical, physical health conditions. So this really can serve folks with complex needs. Example of some of the services are up there. I'm not going to necessarily read the slides to you, but I just wanted to really highlight some of that eligibility criteria for you. And so this is a 24/7, this is 24/7 supervision and care in this like residential rehabilitation center model. So it is secured, it is locked, folks are not coming and going. They are there for intensive treatment, psychosocial rehabilitation, to really stabilize, develop skills, so that hopefully when they meet their treatment plan goals, then they can be prepared to step down into community placements. So can so are we taking questions now, or are we waiting?
Yes or no?
So if you're talking about 290s, that would not be folks who are served in these facilities. Yeah, sex offenders, registered sex offenders. So when we're talking about where are these clients being served now, because we have our clients who need these levels of care placements. And so the way it works is we are having to send folks out of the county, across the state, for these levels of care placement. So the MHRC level is that locked, secured setting where it's intensive treatment. And right now we have contracts for 11 facilities. 8 of those are 100 miles or more away, one way from here. And currently we have, 49 clients that are placed at that level of care. And so what that means is because as you see on here, it's really a service desert. There isn't the services at this level of care available here, not just in Monterey County, but in the Central Coast region. And so in order for us, which is a requirement for us to have a continuum of care for our population of clients, we need to find those placements for folks. And so we have to contract and then have those clients get the services and treatment outside of this region. And then we in partnership, we meaning behavioral health, in partnership with our public guardian conservator's office, then follow up with those placements out of county. Our staff travel to check up on how folks are progressing in their treatment and help facilitate transitions to higher or lower levels of care as appropriate. And so moving on, there was a RAND study, a report that was published in January of 2022, and it really highlights the point of there's a shortfall of these type of placements, these type of beds, and not just the subacute level of beds, but also shortfall of acute beds as well as community residential placement beds here on the Central Coast. And so why is this important for our county, important for our community? Having local placement options not only helps the patients and the clients remain connected to their community. They are Monterey County residents who are needing this level of care, but it's helping them stay connected to their community. It's helping them stay connected to their network of support, if that's family members or other significant supports. And it really aids in that overall care coordination for individuals so that we can move more seamlessly and timely. Because oftentimes in the system, if somebody is, say, on the inpatient mental health unit at the hospital, they are placed under a conservatorship and they are in need of this level of care placement, they may have to wait there while packets are sent out to different appropriate facilities, interviews happen, and there can be delay in placing individuals when they are ready to really step down. So we may find individuals waiting longer than they need to at higher levels of care, and so it can create congestion in the system, because then if somebody else is coming into the emergency room, say, and needs a short-term stay on an inpatient unit, somebody else is waiting in that inpatient bed, and so they can't admit new folks coming in, right? And so that person in the emergency department who may need to be admitted, whether they're on conservatorship or not, may need to be sent outside for an acute level of care bed because there's a flow problem in the system. And the RAND report really highlights some of the bed shortage issues across the state. It's nothing new, it's an ongoing challenge. So just as a reminder how we got here, this process really started back in February of 2023 when the Health Department Behavioral Health Bureau applied for some behavioral health continuum infrastructure program, also known as BCHIP, funding, which came out of all of the propositions that were passed about putting forward these funding opportunities for counties across the state to help build their infrastructure to better serve their clients. And so that started. We were conditionally awarded $20 million in grant funding, and at that time, the plan was for a renovation project at the rehabilitation wing of the old jail. We then learned, as the administration changed at the sheriff's office and things, and just with all of the changes with the initiatives and the implementation there, that the sheriff's office needed that for their own purposes, and so we were not able to use that location. And so in the spring of 2024, Health Department, Natividad, Public Works, and I also do want to comment and acknowledge that we do have folks from our Public Works and Facilities here today as well. Thank you all for being here. We're looking for options of where to move this project to, and the vacant undeveloped lot on Constitution, which is the proposed site for this project, had previously been designated by the Board of Supervisors for health services expansion. And so that was where the idea came to then pivot from a renovation to a new build at that location. And there were we went to the board a few times in August of 2023, again in June of 2024, and November of 2024 with updates on the project. And we also, when there was that opportunity to shift the project from a renovation to new construction, we rethought the model to have a six separate 16-bed units, so that we also can look at leveraging Medi-Cal billing to help sustain the program. In December of 2024, just realizing that the costs were going up as it transitioned from renovation to new construction, and that as we looked at that parcel, realized that there was zero infrastructure going to that area of land, no water, no sewer, no electrical, that there was a lot of work to be done, so that also raised the costs. In December of 2024, Health Department Behavioral Health Bureau submitted another grant application, this time for the Behavioral Health Continuum Infrastructure Program, BCHIP Bond Round 1. Application for $31 million, and we were also conditionally awarded that. And so then we really started working more closely with our public works partners, and you can see the trajectory here. So CEQA, traffic studies, design, all of that had been going. So this again is the area that we're referencing. And early design concepts really looked at how we can make this a peaceful outdoor setting with these secured settings on there. So the buildings can be, open, have walking trails, have park-like setting. And so then here are some draft sketches and renderings on how the 6 separate secured units could be placed on the land, and then also the support building as well as some landscaping. So you can see trees, grass, all of that, walking paths as well. And so then here again is a different rendering. So as you'll see, this isn't a fenced-in, closed campus. This is an open campus design with secured facilities on it. So I'll clarify that. Great. So yeah, as you see, and I don't want to move away from the mic, but okay, I'm going to stand up so folks in the room, and maybe Fabricio, you can help me online. So in terms of the 14-high fencing, that is for the courtyards of the of each individual unit. The campus is open, park-like setting, walking trails, all of that. But the units are secured themselves with double entry doors, with a staff entrance separate from client entrance, and then well, it could be employees of the larger county campus. It could be people taking their dog for a walk. It could be, so here's the 14-foot fences would be for the courtyard. So as we move through the different renderings, you see different angles here.
Question about the fencing, because when I was reading through the
Can-
information.
Can you, good morning.
The mic, please.
Could we make sure you come to the mic?
I'm sorry, other people are calling us, I'm just not thinking about that.
Please use the mic, yes.
Sure. As I look through your renditions and as I've read on your reports and I've gotten online on the state and watched meetings, you're showing us I don't know, anybody can do a PowerPoint. So that's a PowerPoint. And those pretend families walking around with dogs is not a reality. I'd like to know, I read that there's going to be fencing all around, right? So secure fencing.
No,
Well, it said that.
no, secured fencing for the individual units.
Okay, are you showing those on your rendition?
The fencing is.
Where, can you point it out?
This is the fencing. So it's
So
designed
are
to,
you saying, excuse me, I'm sorry, I'm just trying to get information here. So are you saying that brown area going up, like, that's the fencing?
so that's what the community is seeing. And so what I want to clarify is the design is to make it look therapeutic, treatment setting, blend in, not as like an institution, all setting. And so this is the external view of what the community would be seeing. The internal side has to meet all of the licensing requirements for no climb, there's a lot of licensing requirements that the state has for this level of care facility. And so, yes, so those fencing, it is designed to look home-like. And just the comment about the individuals and the cars, the individuals that are put here, it's to help illustrate scale so that folks can see size, they can see sort of the scope, like what's the size that we're talking about here. So you see cars in relation to buildings, in relationship to the space. And so this, for example, would be one of the buildings with the staff entrance back here in the staff side of the house, and then the public facing, so visitors, folks coming in would be coming in that front door. Here's another, that was a higher view looking down. This is more ground level. So you're seeing the same thing. And again, this is more ground level to show the trees, the individuals, and things, again, for size and scale. Here's another. Can I please finish the presentation?
So, question for you. Do you have a question or a
Yes.
comment?
I have both.
Okay, so we can.
It's in regards to the safety.
Well, we can answer a question related to what you're showing, but we do want to get through our PowerPoint because we do want to make sure
My
everybody
question will
has.
be quick.
Okay.
So I'm retired from the California Department of Corrections and Rehabilitation. Okay, so I worked at a prison for 29 years. That looks like a small prison. Prisons are designed to keep people in and out. Okay, so now you have walls. We have walls outside the entire perimeter. Vehicles cannot even go inside a prison setting unless they go through a so-called sally port. This is an open area. You say you have walls around each individual structure. Those walls are easily will be accessed. Trust me, I've seen it before in my career. Those walls are nothing. They will get over them. They will find a way. So once they get over the walls and walk across the green grass and mingle with the people supposedly walking their dogs and being out there with their children, my house is 200 yards away. So the walls need to be around the facility, not within the facility. That does nothing. The walls, first of all, I don't want it in my backyard. And the way you have the walls set up, there's no walls. It's just a backyard cement area, 16 feet. They can climb that. Easy. Easy. That's not secure. And my second question is,
Okay.
are you gonna have custodial staff in there for these people, or is it just?
So can I just clarify again? This is not a criminal justice population that is being served here. These are not incarcerated persons who are being served in this facility. These are folks who have a serious mental illness, co-occurring condition, who are under an LPS conservatorship for grave disability. So these are a very vulnerable population who are there to receive intensive treatment.
I worked at the hospital within the facilities, and I've seen firsthand how they act. You don't have to be incarcerated not to be dangerous. You could be a normal person and be dangerous. So the incarceration part of it has nothing to do with it.
So just to clarify though, and which is why I spent a little bit of time kind of pointing out where this fits into the level of care system. If somebody is acting out, unstable, dangerous, they're going to be in that higher level of care placement in an acute hospital, getting medication, getting stabilization, but they cannot maintain long-term in those locked settings. Once they are stabilized, they need to transition down to lower levels of care to continue receiving their intensive treatment and progress in their treatment. So,
And if I may, to address, I'm going to try to see if I can remember what our public works staff member said. So the inside of the fence will be overlaid with some mesh material that prevents it from being scalable, meaning it will not be able to be, nobody will be able to climb it from the inside.
Can people throw the drugs in from the outside?
Can we finish with the PowerPoint?
Yes, thank you.
Skip through the-
Thank you very
Thank
much.
you.
So we will reserve.
I'm gonna stop you there for a second in your PowerPoint. Yeah, no, we've been going through these meetings for weeks and weeks. I want to ask the important questions. I'm gonna ask the important questions.
Okay.
No, you've had a year and a half. You've had a year and a half to present this to people. You've had a year and a half to present this to my community, and you haven't. Now all of a sudden you want an hour and 90 minutes to present to folks who are just now coming to light, okay? And I apologize, I don't want to interrupt the time, but I've been here before. And I just want you to hear me out just for a second, because we've been listening. We've been listening. Now, I understand that, but it's time, because this is it before the next one, honey. This is it, and I apologize, I don't mean to call you honey, it is downgrading. But what I want to remind our community is, how much money are these guys talking about spending?
Borrowing.
Oh, okay. Borrowing, spending. Kamala said it best, debt is debt. Anywho, let's get back to the point. Why I'm here at the podium, and I don't want to waste your time. I want to ask you, when you did your research on this, did you inform the community or the board of what percentage of monetary value is going to be on our community? What's it going to do to my neighborhood, my community? And I'll give you the answer, okay? Within less than a mile, it is 17 to 18% on your property values that you worked hard for, that you picked out to move to, that you brought your kids to because you knew a park was coming. Now, let me tell you what happens inside a mile of a mental health facility. It goes into we're going 25% on property values, okay? We worked hard for this. You guys have been spending months and months preparing this. You're giving us moments. So don't sit and act like you're like, let's give the community a chance. This is our chance, folks. This is our chance to ask those important questions. When Sheriff Nito was voted in by our community leaders, and she adhered a project that she wasn't assured of, that didn't fall in her budget timeline. which my understanding, she said is a vital resource, and let me get this if I'm not right, because some of you all work there. A spiritual center? An education center? How much do those facilities bring back to my community to make up for the difference that I'm losing in the value? Not only the communities that you're begging to bring to our neighborhood to play games with other children, to blow up a beautiful park. Oh my God, you guys, it's amazing. But your value that you're bringing to our community, and I'm gonna go back to the beginning of time of this project. Most people here knew that mental health is a ginormous issue here. But when you actually look what the big issue is, it's not mental health, it's homelessness, it's affordable housing. And again, we want to spend millions of dollars of unprojected money. You don't even have it in your pocket to do. And how many millions of dollars does it take to maintain this facility on a yearly basis? Go ahead, give me quarterly, we'll take
So,
it.
so
We're
thank you,
simpletons.
thank you. I hear some questions in there that we do have in our presentation. So
No,
we
ma'am,
invite you.
don't. I've been here before.
So we invite you to
You've not
come back.
answered.
We invite you to come back during public comment. For those individuals who have requested that we
there's
continue
your
with the
laptop.
presentation, we're going to go ahead and proceed. So please hold your,
I mean, if the
please
money's
hold your
back to you,
questions and comments till
then
the
it'll
end.
be.
Thank you.
Yeah, shut us down. I'm gonna tell you guys right now, 25% of your home values, your property values.
IT, if you
That's
can
what
bring
it
back up
is.
the slide deck, please. So we're going to move on.
May I just make one
So we're
request?
gonna
I'm going to
move
make a
on.
request of you, because the last time, yes, I want to see it too. And I want to make a request. Okay, well, you know, this is going to go on forever. If you, no, please don't. I want to tell you, I just want to make a suggestion that the last time we were in this room, you took a very long time on your presentation and you gave a very short period of time for people to speak. And so I would like to make sure that we stay in this room until everybody has had an opportunity to speak. Thank you very much. Thank you very much. And you can take your turn too. I'm sorry. People like you are not going to shut down the community's free speech. Good for you. And that's why I asked that they continue with it and give everyone time. And you will. And you will. Thank you very much. But that's not going to work.
Okay. So,
Do you work for the county?
No, I do
Well,
not. And what does it
congratulations.
matter? I'm a community member, and I'm a homeowner. I want to hear. Yes, thank you.
so we are happy to try and push through this presentation as quickly as possible. If we can kind of just hold the comments until the end. I do realize we have folks who might be seeing this for the first time, so I want to be respectful of that as well. So thank you. So inside, this is a draft of the proposed floor plan. And again, you'll see the green are the client courtyards. That's where on the outside you saw the fencing, that 14-foot fencing. The orange here are the staff service, the back of the house sort of thing where there are not clients, where the staff are, where there's the kitchen and the staff work areas. The back of the house. The blue are the residence rooms, and the yellow is that shared treatment space on the inside of the internal programming area. And then here is sort of that view from above, and you'll see the courtyards here. And so these internal renderings, again, the figures are there just to show you size and scale. The furniture's there to show you size and scale, but this is sort of that central activity area. Here's the dining and activity area. Behind this roll-up door is the kitchen on the other side. There's also another door here, and so there can be that food service area, and this can also be an activity area for programming. Here's an example of the semi-private rooms. and the lounge living room area that's in the wings in between the rooms. So that's also functional space. The support building, the proposal does include for the full campus build out would include that support building to support the facilities. This is 24/7, so being able to have that kitchen, the maintenance, generator, all of that. And here's a from above looking down sort of rendering of that support building, as well as a ground level view. And again, the cars are there just to show scale. And now I am going to turn it over to Fabricio to give a high-level overview of the project cost factors.
Thank you, Melanie. So we do want to spend some time talking about the project cost. So as it was shared earlier, when this project was originally estimated to be a rehabilitation of the old county jail, that was projected to be $45 million. Once the project was moved to a new build, the health department provided a rough order of magnitude of $75 million that was based on a previous construction of a clinic located on Sanborn. And then once we got architects, engineers, and actually looking at the details of what would entail, the project increased to $172 million. So some of the things that were included in that revised project budget was that, as it was noted earlier, the parcel is undeveloped. It has no water lines, no sewage, no power, no data. So that all has to be brought in. Additionally, we have tariffs that we see now. There's cost escalations. There's offsite improvements that need to happen on Constitution Boulevard, and then normal increased cost on these type of projects. Additionally, the project does include a 20% contingency on top of the budget. So that is for any unforeseen cost that we might see down the line. And also there is some CEQA mitigation measures included in here. This is just a high-level overview of what the $172 million include. And then so the two construction contingencies at the bottom just shown to reflect that it's about a little bit over $25 million. And then if we go over to the next slide. So this is the other side of the coin for this project. So this is the finances that are currently available for the project. So as mentioned by Melanie earlier, we do have a $20.1 million grant from the BCHIP Round 5. That has a 10% local match, which we were able to leverage the value of the parcel. Additionally, we have, we're pending approval on the BCHIP Round 1, Bond Round 1, the $31 million. That also has a 10% local match, and then the Behavioral Health Bureau is leveraging mental health, futurely Behavioral Health Services Act funding for that. And then we do have a $118 million gap, which a portion of that was presented back to the Board of Supervisors on November 2024 as potentially leveraging debt service, whether that is certificates of participation or bonds or loans from the iBank. But that's currently how the funding for the project sits at this point. One of the things that we have heard in the past is that these monies are better served in other projects or needs in the county. And so we wanted to just spend some time on our budget. So behavioral health has a $192 million budget. We do get some general fund contribution, but that's only $532,000. And that really is a requirement by the state in order for us to draw down those additional funding sources. So of our budget, most of it, it's restricted into what it can be used for. We can only use it for behavioral health services. So while we understand there's needs, unfortunately, this fund cannot be used for road repairs or things like that. And then just kind of moving on to the project timeline. So this is some of the highlights that we have done to date. And then essentially, if this project it's approved by the Board of Supervisors on January 6, 2026, then we hope to complete environmental review in spring of 2026, secure the additional funding that is needed by the summer of 2026, begin construction in early 2027 and have the project completed in the summer of 2029.
So in conclusion, before we open it up for public comment, both in the room and on Zoom, we just wanted to summarize, that having this type of facility in our community would provide the much-needed local placement option for our Monterey County residents who are under conservatorship. It would help to support in their overall care and coordination. Oh, okay. And we've shown you what the timeline is in terms of the construction of the project, as well as how it will be funded. Again, we want to stress that this will be funded by current and future behavioral health revenues, which are restricted only for the use of providing services, care coordination, treatment for our residents who are experiencing a severe mental illness and/or substance use disorder. Yes. And as I mentioned, it will be the responsibility of the Health Department Behavioral Health Bureau to ensure that we pay off any debt that is incurred as approved by the board. And the board has not provided official approval for this. As we mentioned at the beginning of the meeting, we will return to the board on January 6th at the 1:30 time slot to present them an update on our project. And so this slide just shows what we've heard from our previous community meetings. And so we welcome any additional thoughts, comments, questions on the project that you would like to share with us today. And then you'll do the 3 minutes. And so we are going to limit public comment, as Melanie said at the start of the meeting, to 3 minutes per comment. Marty, the one in the room holding the pink pad to your left, will be timing you. And we please ask, there's a lot of people in the room and on Zoom who would like to express their thoughts, to please, when your time is up, we ask that you please respect that and go back and sit in your seat and to give other people an opportunity to express their views.
And just as a reminder, we intend to rotate between comments in the room and comments online. And so, and Marty will raise the pink to let us know that there's a comment online. So we will start with a comment in the room first, and then we will go to a
First
comment
comment is you
online.
spent an hour on your 15, 20-minute presentation, and that left little time for the people to comment. My name is Robert Roach. I'm a longtime resident of Salinas. The jail was here when I moved in. I accepted that. When they proposed the homeless shelter, I did not oppose that. I do not want to be a NIMBY. We need the services, much as the mental health services are needed. And what happened? People said, oh, we'll bring the homeless in our neighborhood. Yes, we got a huge homeless encampment around Upper Carr Lake. It took like 2 years to clear that out. And we still have an ongoing homeless problem in this neighborhood, right? Because Salinas moved all their homeless out to Creek Bridge. Why has Creek Bridge become the place to put all the criminals, the homeless, the mentally ill, and the drug addicted? Why is it in our neighborhood? This is not compatible with our neighborhood. And it's not secure, as the gentleman from Corrections pointed out. This has all look of a botched project to me. Botched project, because you got a $20 million grant, and then you went around, you looked at all these different sort of renovation projects, and now you've got a $20 million grant, and you want to build a $172 million facility? I mean, come on, really? You're going to borrow $63 million of money on top of all the other bonds you've already had passed to build this thing? It's ballooned way out of the reasonable cost range, and it's not compatible with our community. It's simply not compatible in the middle of a neighborhood, across the street from a youth sports facility. This does not belong here. I know that the county wants to put it here because you've got the land. It seemed like an easy deal, but I think the residents of Creek Bridge are tired of being the dumpy ground for the city and the county. And how many more employees is this going to take?
All right, so we're going to rotate to a comment on Zoom now. Marty, can you please unmute?
Yes, of course. We have questions from Aurelio Salazar. The first question is, can someone clarify in terms of the outreach requirement for this project, was it communicated that the Monterey County Behavioral Health Department only had to notify those who live within 100 feet from the proposed site, If so, how many houses met the 100 feet?
I'll answer it.
You can start.
Yeah, I can start. So actually, we notified, sent mailers at the beginning to homes within 300 feet of the property, and that was a total of about 74 homes. We did public outreach to a smaller area, and then earlier this week, we also sent a mailer out to homeowners or homes within 1,500 feet of the border of the property. But correct, the requirement's only for 100 feet.
Okay, we did have another question from Mr. Salazar. If the Board of Supervisors decides not to pursue this project in part or in full, what happens to the previous approved funding?
So any grants that the county has been in receipt of for this project would have to be returned to the funder.
Hi, good morning. My name is Jaime Padilla. I live on, right there on Little River. I have multiple questions. First question, just to piggyback off the gentleman, do you have any concrete numbers of other facilities of people escaping, right? If so, can you provide that, right? Because it's a 14-foot fence. Do you have numbers of people at other facilities, if they're released, do they just, walk out? Because in front of my house, there's tons, not tons, I have many homeless people right in front of my house. I can't even take my son, my 12-year-old, can't take the garbage out, right, by himself, because I'm scared, right? Nothing is done by the county or the city. They're there, everybody knows they're there. The TV was out there a month ago, right? Nothing is done for the homeless. People that get released from the hospital go right there where I live, right in front of me. On Saturday, after Thanksgiving, I was shooting basketball with my kids. Somebody came across from the creek and was asking for help that somebody had just gotten released, a homeless, from the hospital, and was right there, right? So by having this facility, it seems to me that it's just going to increment the problem that we already have. Also, was any public safety study done before the placing of this facility? We have 2 schools, right? Kids walk to schools. There's an elementary school, right? And there's Ever Alvarez. High school kids, middle school kids get dropped off at the bridge right there on Little River, right? Any concern about that from the county? Right, we already have incidents where their phones are stolen. It's people don't walk by themselves. It's scary. Was, like I said, was any safety concern studies done by the county before the location of this was chosen? And I'll stop so you can answer my questions with the rest.
Okay. Okay, thank you. So I do just want to again clarify that when individuals are ready to be discharged and to transition from these intensive treatment settings back to the community, they're going to be doing so as part of their care plan in coordination with their conservator, with their care coordinator, with their treatment team, and they're going to be transitioned from here to the next place that they're going to live. They're not just going to be let out or just released like perhaps from the jail or the hospital. Like, this is all a part of intensive treatment, and we are responsible for care coordination as folks move from different levels of care. So I do just want to make sure that we clarify that is a requirement of treatment, that we provide that. So hopefully that addresses that concern. What were the other questions?
Numbers of people who are able to escape. Do you have data?
So I don't have exact data to answer your question on like numbers of people across the state who have, gotten out from these type of facilities. But I do know that this model was based on the San Mateo County model. That is open and operational now. It's the Cordilleras model. And that is actually what the 16-bed unit, like the design, was based on. They have an open and operational facility in San Mateo County with a campus with 4 16-bed facilities there. And they've been open since earlier this year. And I did ask this question of them for that program, and was told that there was like one instance where one individual followed, like there was something with a door, and one female resident did walk out. And so with those designs, we have solved that problem in the design model of these renderings to eliminate that as a possibility of happening with that same situation. So in the time they've been open, there was one issue, and the person did not get far and was brought right back in, and that issue was resolved. Do we have somebody online? Thank you for your questions.
We have another
We're
question.
going to alternate.
We have another question from Aurelio Salazar. Could this project be conditioned that it would only serve those who were previous Monterey County residents?
So we want to design it for current Monterey County residents is what our goal is. As was mentioned previously on a slide, we currently have about 49 of our residents. These are our neighbors, children of friends, potentially cousin, sister, etc., who unfortunately are being housed way outside of the county to receive this vital service that they need. So if the board were to approve the project as presented, at least half of it would be for Monterey County residents. And as you saw on the map, there aren't other facilities like it in the surrounding area. And so hopefully it would create a easier access point for some of our neighboring counties to be able to contract with the service providers to be able to house their residents much closer to their family, therefore hopefully creating an opportunity for family members to be able to come and visit their loved ones here. Thank you for the question. We'll go to the person in the room.
Yeah, hold on. Thank you. Yeah, hi, my name is John Brady. I am 63 years old. I've been in the mental health system for 40 years. I'm a schizophrenic. I take medication every day and it helps me. I am an artist. I paint words on mugs with any color paint. I buy my mugs at the dollar store. You can buy mugs any size and shape online, and they're inexpensive. The paint is inexpensive too. I'm writing this because I want to share my hobby. So you are an artist or want to be, I would sell my mugs for $5 a piece. And it's a great feeling. It's not messy, and it uses only a household oven for 35 minutes at 325 degrees. You can, if you can paint other things like words, would be good. The hobby I've never seen this done in Monterey County. I was wondering if parents or relatives or friends have maybe a shop somewhere to sell mental health art in the future.
Thank you, John, for your comments. Marty, do we have anything else online?
We have a comment from Lori. Comment reads, my parents bought a house in the neighborhood backing up to the proposed area. As a child, I have seen officers searching the fields for escaped prisoners from the Natividad jail. As an adult, I have been part of a trial about an escaped prisoner from the Natividad jail. I realize this is not a jail and these are not prisoners. But really, how can you assure us that no one will escape? We still live in this house and need real assurance. As the correctional officer said, the fence going in as well as out needs to be secured along with the windows.
Thank you for the comment. Back to the room.
Okay. My name is Rosa, and I'm a family member of a loved one with mental health, and she was diagnosed about 10 years ago with schizophrenia. I bought my home here. It's no news to know that there's going to be buildings, there's going to be parks. When I moved here in 1999, I knew that I had made a choice to purchase the home a little farther away from the jail when there was no buildings over here. The houses were barely built. It's a choice you made, and we knew from the beginning, when I never lived here in Salinas, but I knew from the beginning what was being built around the home. Now, the only thing that I thought was to advocate. I had never gone through the mental health situation until my daughter was diagnosed about 10 years ago. And one of the things is that Natividad Hospital has always had a mental health ward, or whatever you want to call it, and it's had a fence. They walk outside, it's a little patio, it's small, but I can tell you, it needs to be renovated, and I think and I support this, what's going to be happening right here, because we need a facility, a better facility than what Natividad Hospital has. And you know, as far as the getting out and you know, escaping, let me tell you, people don't try to get out. They try to get the services. They try to get the support they need. You know, as far as I know that the struggle that I received not having a bed here when she was diagnosed at the beginning, I had to travel 4 hours to Santa Rosa and 4 hours back, and trying to make sure that I was there for her. And every day it was really difficult to find you know, time from work, money for gas, and to purchase things that she needed while she was there. The only question that I have for you, and my concern, was when I was in Santa Rosa, they had inmates also mixed in, and I know that it wasn't a good moment for her having inmates at the same time with her. She was very scared, and that's the only concern that I have here, is to make sure is the people, you know, those that are in jail, incarcerated, are going to be part of there. And I wouldn't want any young person to have to go through having to be in the same place with someone incarcerated. So that's my only concern, and I applaud you and thank you for having to have this service in our community.
Thank you for your comments. And to answer your question, again, this is for LPS conserved individuals, so not those facing criminal charges or incarcerated persons from the county jail. So this is separate. This is for folks under LPS conservatorship. Oh, wait, sorry, sorry, my bad. I gotta check back on Zoom. Okay, back to you.
Good morning. Jose Guerra, Montevilla Community. I just, first of all, want to commend you guys for trying to do a good presentation. Excuse me. It takes a lot of guts to do that. The problem is, you have to understand, unless you live in this neighborhood, I mean, I don't live in the neighborhood, but I understand, because no matter if I live there or not, we will inherit the expense of this project, regardless, throughout the whole county and city. That's my one thing. And like gentleman said, Department of Corrections, you know, I started at San Quentin. Let me tell you, JCATs, that's what we used to call them. They went to triple CMS, now they're EOPs. These people are dangerous. When they don't have their medication, they're a different person. And they cheat medication, they do different things, very manipulative. The difference between an inmate and a person that's on medication is a very fine line. The fine line is this: when they don't have their medication, you don't know who they are. They turn to a person that you'll never know who they are until they're attacking somebody, until they get what they want. So for you to have an open space like this, do me a favor. All you guys, go visit a prison. Hey, Soledad's right here, 20 minutes away. Please go visit it. See how it's fenced in? Double fence. In the middle, we put rocks. At Quint, there's big quarry rocks. So if you fall off the fence, they're hoping that you hurt yourself, break your leg, and you can't run. That's why they're built that way. So double fence, you need that. You can't have just a regular 14-foot wall, nice-looking scale fence. People will get out. People are smart. They're manipulative. They will take that card, and they will scan it. They'll make a copy. They'll do something. Do me a favor. Have you guys tried about ankle bracelets on them? So if one of them tries to get close to the door, the alarm goes off? I mean, have we really thought this through? I mean, have we? Because you can actually, you have the health department up here where you can build that facility. Yeah, right up here on the top. You have the old hospital right behind me over here. It's perfect. You don't have to waste all that money and you know, and make electricity and the water and all the sewage and all the stuff you're trying to come up with. That's a waste of money, gentlemen, you know, ladies. Sorry. I mean, it's just my opinion. And I'm very concerned because unless you've ever worked in a department like that, you don't know what it's like. You don't know what you're getting. Every day is different. You want to go home every day. And you're going to expose these beautiful people to something like that they have no training. They're not aware of what's really going to happen. Things happen really bad in there, I'm telling you. Someone can get really hurt. Someone's kid out here, then you're going to have a lawsuit on your hands. Who's going to pay that? The city of Salinas. The people that pay the taxes are going to pay all that. Thank you. Have a great day. God bless you.
Thank you.
I'll wait to see if anybody's on Zoom.
Anything online, Marty? Okay. back
Okay.
to the room.
My name is Yolanda. I'm a neighborhood watch and advocate here in Creekbridge. We're not opposing the facility. We approve of the facility. What we don't approve of is the location. This is the wrong location. It wasn't thought out properly. The residents weren't informed, and it's just going to impact the community. Thousands of residents live here for a 96-bed facility. 2/3 of the population in Salinas live in this area. Creekbridge is 60,000, Eastside is 30,000. That's 90,000 people. That's 2/3 of the people, and you decide to put this in a congested area? That's not proper planning, especially since nobody was informed until just a few weeks ago. This location, the only positive thing that I've seen that has brought in people is the soccer field. I call this the gateway to Creekbridge and the East Side. This is the area that you're looking at is prime location. It's prime land. To have a building, a mental health facility, as you enter the area brings more negativity. Who's going to want to buy in this area? They're going to look at this area, and right in the prime of entering the community, you have this mental, for seriously ill people. It's not, you didn't plan this properly. Now, I've been out to the neighborhood and I've been canvassing the audience. First thing they say is, this is Sheriff Niero's fault. Get rid of her. Let's call her. Let's do a recount. They all are blaming Niero because of the decision she made when she didn't want them housed in her facility to have a laundry and a prayer meeting room. So that's what I've heard. At least from 6 people I heard that. So recall. The first thing that comes to their mind, recall. There's other locations. Why does Glen Church have to take all this rubbish from everybody in the county? All the supervisors, they don't live here. None of them live here. Sheriff Neto is not a supervisor, but she lives in Pacific Grove. I'm not going to say each name. You all know who the supervisors are. None of them live in this area. None of them know the community. They come in and they say, oh, prime location, Creekbridge. Let's send everything negative to Creekbridge. That's not fair. We count. We are the community. We live here, and we deserve our area to be respected as we do, as we should be respected. There's places like Greenfield. There's, this is not about compassion. This is because you want to bring money to Monterey County. That's what this is about. If you had compassion, you take care of all the unhoused people in the area that are suffering, that are already mentally ill. Those are the people that you'd be taking care of. So this is not about compassion. This is about money. Money in the future. You're going to bring more people, and you're going to bring them from all over, not just the Central Coast. It's going to be all over California that you're going to get them because you want that money. Thank you.
Thank you, Yolanda.
Thank you for your comments. Do we have anything online, Marty? Okay, back to the room.
My name is Peter Econom. I've lived here for 25 years. When I first moved down here, as others have mentioned, the jail was there, and many of us made the decision, yes, the jail is there, but the area is nice. We decided to move here. Now, the question I have is, was there an environmental impact done in deciding when or where to build this facility? What is the impact to the neighborhood? We've talked about property values. There is also the security. And overall, for something as fundamental as this environmental impact study, it's really important because then we get to understand the impact it will have on the community, not just now, but in the future.
Thank you for your question, and we have some of our Public Works facilities folks here who can speak to that and answer. Luis, do you want to take that, and please come to the mic so folks online can hear as well? Thank you so much.
So the answer to that question is yes, there is a CEQA, ISM&D, initial study, mitigated negative declaration that we, the county, have been working with our consultants, and that specific environmental document is expected to be completed in June of this upcoming year. As you understand, it's a big site. You know, we're making sure to do all the proper due diligence, all the studies that are needed to do a really good job with that specific document. But there's still more time that we need to complete it, but it's underway.
How much are you spending on the environmental documentation? Which, by the way, doesn't cover how it affects the community at all.
Yeah. I don't have a number from the top of my head on what the specific costs for the CEQA, but because, you know, I started in the middle of the project, but I will say it's anywhere between 100 to 200,000 that are being spent on preparing the CEQA document, because it's a big site, and as you all know, CEQA environmental documents are complicated, very highly technical, and part of those involve, historical, cultural studies. We have to study the site itself too, geotechnical reports and other things, traffic. All of those have to be baked into that environmental report.
The further mitigations will have to be paid for based on the outcome of the environmental analysis.
As part of the CEQA process, we have to address all mitigation measures, and those are and will be baked into the financing numbers that you see there.
So even the 172 is really not the final number.
That is the number that we are sticking the project to, and it's all inclusive. And we, the county, have already done what it's called a professional engineer's estimate to make sure that, you know, we have a solid number as to what the project will cost.
When did you start the CEQA process?
The CEQA process. The CEQA process for this specific site, so, you know, there has been 2 sites that had been discussed for the project. On the new site, that environmental process was started in November of 2024.
A year.
Mm-hmm.
You have an initial study available?
As I said, you know, we're working through that, and we don't have it, yeah. We're working on one of the most difficult parts of this project is the traffic. And so we are working on that.
Shouldn't that be in place first before a final decision is made as to location? I mean, the factor is going to be based on the outcome of the CEQA, isn't it?
The CEQA has to be completed before the building permit or the entitlement documents for the project are completed. That's when the CEQA has to be completed.
As part of CEQA, you're supposed to be doing outreach to the community, and you're a year in, and we're just hearing about this. So CEQA requires community stakeholders' input. That has not been diligently sought. Actually, it's been blocked, which was admitted by Mrs. Jimenez, that she stalled that because she knew we were gonna have this reaction, which is not, you know, that's not baked into the state and what the state says you have to do. When you have to inform residents, you're supposed to do that, not just put your own personal opinion. Well, I'm gonna get as far into this, spend as much money as I can, which you admitted in front of all of us here that you did. You didn't want to tell us. And so, because you didn't think we would agree with the project, so you continue to spend. And I would like to correct something that was said.
you stated when it came to the county board, the county board halted you on spending any more money. They halted you.
So-
They said, stop spending money. The costs are astronomical. And when it comes to the 172, that does not.
So, Miss
include
Margaret, can
that would be
the people on the Zoom can't hear you? So, do you have a
No.
question for Luis?
And also, I would like to just clarify one thing. So, right before the Board of Supervisors decided to put the project on hold, we were actually very close to having a draft of the CEQA ISM&D.
No, you put out for another draft and they told you to stop because you were spending more money.
I am
Anybody
specific.
can get online and watch the meeting.
I am
If they have questions,
specifically,
that's correct.
I am specifically talking about the CEQA ISM&D. That document was very close to having a draft, and because the project was put on hold, we were not able to complete it. Once that draft is ready, that is when we, as a county, have to do a notification to the residents, and there's also multiple notifications that are part of the process. But as I said, that's why it was projected that the CEQA ISM&D was going to be completed until June, because it is a reiterative process. We have to first put out an initial draft, then we collect comments, feedback from the community, that comes back. We baked in those comments into the draft, and then it goes back again to the community before it gets formally adopted or accepted by the Board of Supervisors. And so that's the process, and that's why there hasn't been a notification from the CEQA perspective to the residents, because we don't yet have a draft.
So
That's the
can
reason.
you answer this question? So why did they put a halt to the spending of the money?
That is a decision that the Board of Supervisors
No,
decided
they-
it's not on mine.
They plainly spoke it to you at the meeting.
How many more cars do you you talked about traffic, right? We have a huge traffic problem in the morning.
So,
Going right here at the hospital.
I really hate to interrupt, but folks cannot hear online.
On Constitution?
I don't have those numbers
So
with me.
I really, if there's questions and stuff from the room, I really want to just remind folks to please step forward and use the mic so that folks online who are also listening via live stream or Zoom can hear. We're happy to have the conversation. We just want to make sure everybody's able to hear, and we also do have some more questions online. So are there any other questions about the CEQA right now? And if so,
I'll ask the traffic question on the mic so that people can hear.
there you go. Thank you.
So he mentioned traffic, right, as part of the report. So what is the number of cars that you expect on Constitution on a daily basis? What increment, what percentage, right? We already have a huge traffic problem at in the morning. Also, you didn't answer my questions. Were there any safety studies done, right? When I first spoke, you didn't answer, right? If any safety or crime studies were done prior to the project.
So to back to that question, then my apologies if I overlooked that, but I do not have data to speak to that at this point, but I did make a note of that.
So no study was done, nothing was done. Like a crime study,
Maybe I'm not understanding your
yeah,
question.
about crime. How is crime going to be affected when a facility is built, right? Safety concerns. Was anything done by the county?
Are you talking about this type of facility in general, or are you talking about this site specifically?
The facility, right? You're going to build the facility. Don't you do a study like how is it going to be the neighborhood impacted? Will there be more crime, right? How are we going to put any safeguards in place? No, nothing.
In terms of a crime study for this specific neighborhood?
Crime resulting from, is that what you're asking?
Yeah,
I don't, that wouldn't be something we would study, but I'm not sure anecdotally if having an MHRC in your community increases crime. As we've stated, these are clients who want to receive treatment. It's our loved ones who will stay. They're not criminals. They don't have any pending charges. They're not going to try to escape. They're there in a therapeutic setting. And once they receive the treatment that they need and are achieving their goals, then they will be discharged back to home. So I don't know if there are any studies that associate this facility
and to
increases
be fair,
crime.
I have nothing against the facility, and we need the help. But the county has done a lousy job, or the city, with the unhoused people in our neighborhood. I have many living right in front of my house, across the street on the creek, right? There's many going around, walking around in bicycles, stealing whatever is out there, and nothing is done. So you have to understand our concerns, right? If this problem is not being solved, right, and you're gonna bring something else, though, it's just gonna get worse, right? Nothing is being done.
I encourage you to seek out your city council and attend their meetings and express your concerns. All right.
So if I can just, sir, I'm sorry, I don't know your name, but you did ask a question about the traffic study, and before Luis walks away, I want to just give him an opportunity to, if there's anything that you can add about the traffic study.
Part of the CEQA that's required a traffic study, and the same kind of similar answer as I said before, that was about to be completed when the project was put on hold. But one of the key things that had been discussed in there is each of these MHRCs are going to be staff, and that's where the traffic is going to come from. Each MHRC in any given turn is going to have anywhere between 10 to 15 staff at the most. As you can see, this project is only 6 MHRCs. It's not going to contribute to necessarily a lot of traffic because it's only 6 buildings, 10 to 15 people. I think what we have to consider here is we have a lot of facilities from the county. We have a jail, we have the hospital, we have the Salinas Regional Soccer Complex, and we have our project. And part of the CEQA ISMND and the traffic study is really looking at the impacts of all the vicinity uses to really find this. And as the traffic study was being worked, one of the key items that was mentioned was the introduction of a traffic light to really control traffic, slow traffic, made access into the project site easier, but also for the Salinas Regional Soccer Complex. And so,
Thank you.
Yes.
Thank you, Luis. And we are going to alternate to somebody online on Zoom, and then we will come back to the room. Marty, what do we have online?
We have a raised hand from a guest. Their username is.
Can you speak up, please?
Yes. We have a raised hand from a guest. Their name is iPhone 17. So, no.
Can iPhone 17 please unmute and ask your question?
Yeah, I just wanted to make a comment. I'm pretty sure the jail and the hospital and the county seat were there when lots of these houses were purchased. And the presentation took an hour because people disrupted and prolonged comments when they were allotted a certain amount of minutes. And now there was only 30 minutes because they go over their time. Treating people horribly with mental health problem is not cool. And it's very counterproductive and adds, it's not only their mental health problems, but other people's also. Spend this disrespect that you're showing to these people that are trying to do their job to the board of supervisors. And you don't, because I watch those meetings every single week, and you don't go down there and talk about this mental health. Maybe a couple have, but it's up to them ultimately. So I advise you just to go holler at them, not just in January, but the next ones that they have, and go every week and holler at them, because ultimately it's going to be their decision to decide. That's it.
Okay, thank you. Thank you for your comment. Let's come back to the room.
Hello, ladies, gentlemen. So I'm here on behalf of my community, not the mental health board who's bringing this project to our community. It's not the city of Salinas, it's mental health facility. I got no problem with folks seeking out mental health. We all have somewhat of it at our front door. May it be on the street, may it be within our families. That is not the dispute that I have with the city of Salinas, not the Board of Mental Health. And that's why we're here, because they're bringing this to us, okay? Because they were told to, and I know these things because I've been attending these. So when I'm talking to you folks, I'm not talking to them. I'm talking to you because I've attended. I've done my research. I listened to what they want to bring to our community. A beautiful 96-bed complex to help folks who need help. Amen, bless you, save your hearts, good, all that business, okay? What I want to talk about is almost $300 million of money that you don't have secured. And I will put the label back on it in my backyard. And I want to remind folks that weren't here at the last meeting. There was a representative for Sheriff Nito. And he was angry when he was on the phone. He called our neighborhood a dumpster fire, and that he was okay bringing more dumpster fire to our. Correct me if I'm wrong, but go ahead. I read the paper article too, and I was here. I listened to it. The only thing that I don't really understand is we're not disputing mental health. Mental health is an issue. All of us sitting in this room have a part of it. What we don't have a part of is the pocketbook that you're willing to spend in a community that I already told you guys, you know my full story. I bought this community 28 years ago. I voted on these things that came into this community 28 years ago. I knew what I was getting. Then the city sold me a lie. One day I woke up to see my backyard on Channel 8, going, I'm going to put a mental health facility in this yard. My tree, my fence. But you didn't ask me how I felt about it. You didn't give me a chance to vote on it. Sheriff Nito decided Plan A didn't work for her. So you guys go, what's Plan B? Let's move them into Creek Bridge. Now we know at least 10% of any mental health facility, and especially if you're going to push on, go ahead, push your buttons. I'll take anybody's time. You want to give it to me. Already brings a 10% increase of drug use into our community. 10%, folks, just by having this conversation. Do your own research. I'm telling you. But the thing is,
Thank you
somebody
for your
told me not
comment. I'm
once, but
sorry, we're out of
twice.
time.
Not once, but twice, maybe even 3 or 4 times. Why are you even bothering with this? Because they're going to do what they want to do anyway. You sold somebody a timeshare. It wasn't us. We're here to talk about the impact on a community at a minimum of 18% to your property. A minimum. Just having this conversation, 18%. They had a Plan A, folks. Sheriff Nito said no. It was a vital resource for the prisoners at their property that sleeps more than 96 people. Already have mortar, already have bricks, already have the infrastructure. You already have all that stuff in place. They already have federal funding for $50 million. Why are we even having a conversation? Doesn't make sense to me. When you took it, because you want to sit there and sell the dollar amount. What you sold at the city council was a return of what? Maybe 10.5%? That doesn't even pay for a year of their maintenance on a facility. Where Plan A already has a facility, already has a maintenance plan. Let's ask the big questions, folks. Where and how is this money coming from? This is not about mental health. This is not about mental health. This is about somebody wanting to spend a ton of money, to spend more tons of money, to drag down a community. And that is a minimum of 18%, folks. 18%. And that's just having a conversation.
Thank you for your
I
comment.
yield to the room.
We're going to go to Zoom. Vamos a tomar una llamada en Zoom y luego venimos con usted. Gracias.
We have another comment from Mr. Salazar. He says, this appears to be a modern-day panopticon. For those who don't know what a panopticon is, a panopticon was a prison designed by Jeremy Bentham during the 18th century, featuring a central guard tower with individual cells, in parentheses, rooms, facing inwards. The major difference being that this is made up of multiple smaller buildings than one larger one.
Okay. Ahora sí puede pasar a...
Oh, sorry.
Can we get the interpreter in here?
We do have one more, or a couple more comments. Folks are asking for the mic to be cut or for people to please stop speaking over the time frame. They're stating that it's disrespectful to the rest of the community.
Thank you. Va a venir el intérprete ahorita. The interpreter is stepping in the room. That's why we're taking a short pause.
Buenos días.
Buenos días.
Mi nombre es Javier Ávila y vivo aquí por la 1645 Atherton Way por cerca de 30 años.
No entendí bien el nombre.
Javier Ávila.
My name is Javier Avila. I've been living here for close to 30 years.
En, mi yarda está pegada donde van a hacer el...
And my backyard is right next to
Donde-
where this facility is proposed.
Sí, cuando me di cuenta que iban a hacer ese proyecto, pues no me siento seguro ya ahí en la casa.
When I found out that this project was being proposed, I stopped feeling safe at my house.
Ya, porque pues, no sé cómo van a hacer cómo va a entrar la gente ahí, cómo va a ser todo.
I don't know how people are going to be coming in, how everything's going to be.
Y pues cuando yo compré ahí sentí que pues era una comunidad buena, pero pues ya están, si hacen este proyecto, pues ya no me voy a sentir muy seguro.
When I purchased my property there, I felt that it was a secure neighborhood, but now that this is being built, I feel that it's not going to be a safe neighborhood
Sí,
anymore.
pues a lo mejor va a estar bien o a lo mejor, pero pues no sabe uno, ¿verdad?
Maybe it's going to be okay, but I don't know.
Pero no me-
Maybe it won't.
Y pues todos mis hijos nacieron ahí y pues ya nomás estamos mi esposa y yo. Y pues sí, porque yo tengo árboles atrás y tengo mi yarda bien arreglada, pero hay veces que sí miro que van gente y pues se meten a agarrar fruta o algo. Y pues
I brought up all my children there. They were born there, and now they're grown up and gone. So now I live there alone with my wife. We have our backyard well kept. We have trees and a nice garden. But sometimes I've seen people come in and pick fruit from our trees.
pues nomás pues no sé qué pensar de este proyecto, ¿verdad?
So I don't know what to think of this project.
Gracias por su comentario. Thank you for your comment.
Thank you.
Let's go back online.
We have a comment from Zoom user. People need to take these concerns to the Board of Supervisors. They will ultimately decide. This meeting isn't the mental health board. There is no mental health board. At the end of the day, the Board of Supervisors will have to give behavioral health direction to move forward with this facility or not. Speak to your district reps, both city and county. That's where this energy needs to go.
Okay, thank you for the comment on Zoom. We'll come back to the room.
Once again, good morning. Jose Garamond Bay community. I just want to say transparency is very important here, and I don't see a lot of it. Knowing you had this project, I know it's been more than a year. It had to be a couple years ago. For you not to come up front with the public and let them know is very wrong. I mean, I'm going to mention again, they did that to us with the H2A building they built in Montebella against our will. They did it anyways. And Chris Lopez, Luis Alejo went like this to each other. You're the rep, you're the rep. So by the time we got to them, it was too late to protest it. I protested online, by the way. I was the only one that attended that meeting online because I was notified that morning at 8:45. And by the time I got to where Barton School is, I pulled over, went on Zoom, and I had to do my comment. And I let them know that I opposed it. My thing is this, transparency is very important. Right now, the city is suffering that because they're not upfront with people. And now the county's having it. We can't have this, guys. We have to have unity. You guys have to work together. I mean, I'm not saying we don't need the institution. We do. Put it somewhere else, though. Don't put it in someone's backyard where they can deal with that, where their kids have to see a place they don't want to see. If you ever worked in a prison, you don't want to be there. It's the ugliest place in the world. And I advise all you, please go visit one so you can know what you're really going to have. Because once they lose it, they're going to be all over the place. Medication has to be altered. Remember, I'm not a doctor, but I'm not dumb either. It's pretty basic knowledge. People get used to medication. That might not work and they go to something else. You don't have it there. What's going to happen? Someone's not going to be happy that day and is going to make a big mistake, maybe escape and hurt somebody. Hopefully not. But I'm going to call out all the supervisors. Where are you guys at? You should all be here at this meeting. They should all be here. All the county supervisors, all the city officials should be here. The mayor should be here. Renee Mendez, the city manager, should be here. Mr. Donahue should be here. All the city council members should be here. I love the online thing. That's great. We want to see your faces here because we pay you. You're paid by us. You're all public servants. Do your job. Come to a meeting. Not on Zoom. Mr. Alejo loves Zoom meetings. You won't ever see him. He won't do a face-to-face meeting with you. I'm calling you, Mr. Alejo. Give me a call. 831-905-0537. That's my phone number. My email is el.big.guerra@gmail.com. Please get a hold of me, Mr. Alejo. I'd like to have a conversation with you. And you guys out here, man, Creek Bridge, oppose this thing. Don't let this happen. You have a right to do that. They need to show transparency. They need to show that they are here for you. All these people are for the county. You pay their salaries. They're your employees. Whether they like it or not, they are. I'm sorry to say that, but you are. You are public health, and you are part of this situation. Where's the police department? They should be here, too, answering questions that the gentleman here from Public Works couldn't. Once again, thank you all. God bless you.
Thank you for your comment. Back to Zoom.
We do have a raised hand from Sandra Bautista. We do have the interpreter present as she is a Spanish speaker. So let me go ahead.
I don't hear from
Yes,
Sandra.
when she's ready, if she could speak.
Sandra, cuando esté lista, por favor, puede apretar el botón para empezar a hacer comentarios. Tenemos el traductor listo aquí en el cuarto.
Buenos días a todos.
Good morning to everybody.
Mi nombre es Sandra Bautista y he estado en las dos juntas pasadas.
My name is Sandra
Nuevamente,
Bautista.
como
I've
les-
been in former
como les
meetings.
comentaba, yo soy una de las personas, mi familia vive aquí atrás de donde se realizaría el centro que quieren hacer. Y nuevamente les insisto, yo soy madre de 3 niñas y es muy preocupante, ¿verdad? Saber que van a hacer ese tipo de centro detrás de la casa de uno, donde uno va a tener pues toda la visibilidad a pesar de todas las paredes que ustedes quieran levantar. Nosotros estamos acá en alto y se ve mucho, o sea, aún así esas 14 pies de pared que quieran hacer, es inevitable que nosotros y nuestras hijas pues no miren ese tipo de espectáculos que pasarían allá.
Okay,
sí
Sandra,
les comparto-
Sandra, necesito poder interpretar porque si no,
Discúlpeme.
no me voy a acordar de todo lo que está diciendo. My name is Sandra Bautista, and I'm one of the members of the community. I live right behind where this facility is proposed. I have 3 daughters that are growing up here, and I'd like to say that we don't feel safe. Bien pueda siga.
Sí, pues ya lo he comentado en distintas maneras o en distintas citas, ¿verdad? De las juntas que han hecho. Y es que no sé qué tipo de papel estamos jugando las personas que estamos ya sea virtualmente o presencialmente en estas juntas, porque hasta ahorita lo único que yo veo es el 99% de las personas que están en negatividad con este centro. Entonces, o no nos escuchan, o no sé qué tipo de personas estén escuchando ustedes, porque pues los que nos interesa aquí estamos, ¿verdad? Y no estamos de acuerdo.
Okay, so one of the things I'd like to point out, I've been in 2 of the previous meetings, and I hear about 99% of the people are opposed to this project, and I don't know what role we're playing in expressing our opposition, because it seems like we're not being heard.
Les comparto un poquito de lo que es nuestra situación. Es relacionado, lo voy a comentar, porque creo que va, ¿verdad? de la mano con este proyecto. Nosotros llegamos a esta casa y cuando la compramos, estábamos pues notificados de que aquí había habido una persona que había que había sido, está, pues más que nada está ahorita, pues digamos mal mentalmente. Esta persona entre su digamos debilidad o sus necesidades médicas no estuvo automedicada en un momento y esta persona mató a su madre, que es con la que vivía en esta casa. La
So,
persona,
perdón. We've been living in this house, and before we bought it, we were informed that somebody who had mental health issues had lived around here and came into this house and killed somebody. Bien,
bueno,
pues.
la persona era hija de la persona, o sea, vivía mamá e hijo aquí, el hijo es el que estaba malo y él mató a su mamá. Lo que quiero decir con todo esto es de que aunque le tengan el trato más, digamos, riguroso, las personas con ese tipo de discapacidad o en esta situación tienen sus momentos donde de descuido, de lo que ustedes lo quieran llamar, donde si simplemente no están, digamos, bien medicados o bien controlados, o sea, tienen sus momentos de arranque o de locura o no sé cómo llamarle, pero, o sea, llegan a hacer varias cosas y en eso incluye matar a alguien y a esto voy, o sea, si la cárcel no es segura, ¿por qué un centro como este va a ser seguro? O sea, ¿qué estamos temiendo todos los que vivimos aquí acerca de ese centro? Que también se salgan y vengan y hagan algo con nosotros, con nuestras familias, digo, por lo menos un buen susto. Yo creo que eso no está bien.
So the person that was living at this house, it was a mom and her son was the one that was mentally ill, and he had an event and he killed his mother. And so I wonder, with the jail nearby, if even the jail isn't all that secure, what it's going to be like with a new facility that has people who are mentally unstable. They have their outbursts, outbreaks, and you don't know what they're going to do.
Gracias.
Thank you for your.
Gracias por su comentario.
Marty? Okay. So
Yes.
I just want to do a time check. We're at 10 minutes to 12, and so just want to
Okay.
bring us all back to awareness of the time, and so appreciate us getting through as many comments as we can. Back to the room.
Okay. I'm going to say this in Spanish just because I'm going to answer to the caller. Para la persona que está comentando sobre el hijo y la mamá que mató a su mamá, le voy a decir una cosa. Voy a corregirla. Fue no relacionado a salud mental, fue relacionado a drogas, ¿ok? Quiero que sepan la diferencia entre una persona que está en drogas y una persona que tiene salud mental y una persona que no ha recibido la ayuda. Es totalmente diferente. I'm going to say it in English. I'm going to correct the woman. She was saying that the son killed the mom and it was, probably had issues with mental health. It was not issues with mental health. It was issues to drugs. There's a difference between the drugs and the mental health. Maybe in some situations it can be both together, but that young man was not receiving, it had nothing to do with the mental health. It was him having to be on drugs. Mental health, I'm telling you, gets confused a lot of the times with having to have being violent. And, this is a facility where people are going to be getting the help. This is not, a jail. This is, I think that everyone is, and I appreciate what you're mentioning, that, we are focusing back in the cost and the impact in the community. And I appreciate that we focus on that than having to be calling this, ankle bracelets or making it like it seems like it's going to be a prison. You know what, we're getting off of the subject and the topic of what this facility really going to bring and impact yes, exactly. And if you're saying that you're not against mental health, then we need to those of us, the family members that are not here, that's because a lot of the times it's embarrassment that they don't want to talk out in public about the mental health that's happening in the families. That's why they're not here. That's why they're not talking up and speaking. I'm a teacher that facilitates mental health classes with NAMI. And I can tell you that a lot of the times they don't receive the information because they're not informed. They're not a lot of the times involved in the mental health with their loved ones because, it's the, what is it, where they're already adults is privacy with a patient. So we get left out. So HIPAA violation, thank you. And that's the reason why they're not here to advocate. Thank you.
So we are going to go back online, and I would like to make sure that we're giving folks an opportunity to speak up if they have a comment, if they have not already commented. So we'll go to Zoom, and then we'll circle back to the room. And so if you would like to make a comment and have not yet commented, please move towards the mic. Marty?
Yes, we have a comment from iPhone 67. Why does the board need to respect Sheriff Tina Nieto's position to keep a dilapidated old building? Sheriff already has a new jail. Doesn't make sense to have a brand new jail built and still want to use the old. If this mental health building was built there, it would be perfect. It's already a jail and addresses safety. It's not her jail. This is the county's building. Why is the supervisors caving to her? It's obviously cheaper to do it there and goes back to the jail away from Creek Bridge.
Thank you. Back to the room.
Hi, my name is Sarah. I live in Creek Bridge, and it seems like this project is expecting to be funded by Medi-Cal, and I have a question. Where do middle income and high income people go for 24-hour psychiatric lockup?
So these facilities are designed for our LPS conserved individuals adults 18 and older, who typically are on Medi-Cal due to grave disability. And so for private insurance, for higher levels of care, that would be within the private insurance network. But what we see with some individuals who have a severe, persistent mental health condition, who are adults and needing to have their own, is that due to their grave disability, they're not able to sustain jobs to have private insurance. And so oftentimes they don't have the private insurance benefit. So they do end up on Medi-Cal.
But there are private insurance facilities in Monterey County for people to go to.
Do you want to answer that? No. So, I mean, in terms of mental health rehabilitation center levels of care, no, there are not.
And the other thing that comes out is they said there will always be Medi-Cal people coming to this facility if it's built. So if they're coming from places like Eureka or Tahoe or San Diego, it's sort of creating the same problem that we're trying to alleviate, and that is people, they're saying, my loved one, I live in San Diego, but now I have to go to Monterey County. If there's openings, we're not going to turn them away. We'll say, here's a bed. So it actually creates a problem when you have a vacancy and there's someone with a need. You're still having the geographical problems with distance.
So these facilities here in our community, the priority would be serving our community, our residents, and that Central Coast region.
But if there are empty beds, you will take people from anywhere in California.
Potentially, sure. I mean, there's bed capacity issues across the state. So yeah, if there are smaller counties who need this facility, and they're willing to provide that level of support like we are currently now doing when we're placing our residents out of county with the public guardian's office, with the behavioral health staff, being there and supporting their transition in and out and following their treatment. Sure,
So
there's
it's
a
the
need
same
across
sort of
the
problem
state.
with the distance.
Yes, and what we're seeking to do is to try to solve the problem for our residents, who we are tasked with trying to serve and support is our Monterey County residents.
Okay, but one thing I keep seeing is that there was a possibility of contracting out. So in theory, you're creating more people who have to travel to somewhere they've never been before.
By adding these 96 beds in our community, it adds 96 additional beds to this very much needed level of treatment and services. And as been expressed, our goal is to bring a resource here locally for our residents so that our parents, our aunts, uncles, whoever unfortunately have to go out of county, as was expressed by an earlier member of the public, wouldn't have to travel 4 hours each way to go visit their loved one who is receiving the necessary treatment for their severe mental illness so that they can come back into our community.
Thank you for your comment, and we're going to go back to Zoom.
We have a comment from Terry Wilcox Rickers. They say, my understanding is that there will be security staff on the grounds to make sure that people passing through on the campus are behaving. This may help neighbors to feel safer.
Correct. There is security, just like the hospital has that 24/7 security because it's a 24/7 operation. The same would be so for this.
Will they be armed?
Thank you for that
For
point.
security? Will they be armed?
Armed security?
Maybe outside the facilities.
I actually don't know.
We don't know.
Would that be outside the facility? I'm just curious. Oh, awesome.
Sorry. Yes, that would be outside the facility on that, patrolling that campus area.
Oh, sorry.
Oh,
I need an interpreter, please.
the interpreter. We're pausing to bring the interpreter in.
Okay, thank you.
Ok, Gabriel, buenos días. Buenos días, mi nombre es María Soto.
Good morning. My name is Maria Soto.
Y antes que nada agradezco esta oportunidad y poder tomar estas palabras para con ustedes.
And I really want to thank you guys for letting me speak these words and having this opportunity with you guys.
Ajá, he escuchado con atención ambas partes y bueno, únicamente quiero externar que creo que ambos lados, tanto ustedes como a personas de gobierno encargadas de este proyecto y los vecinos de esta comunidad, creo que ambos tienen puntos de razón.
I feel like I've been hearing everything, and I just want to bring this my attention. I could hear the different parts. I could hear both sides. The government's project, and then the neighborhoods. I could hear that you guys do have different points.
Yes. Por ejemplo, creo que el proyecto en sí es muy bueno. Siempre toda sociedad, ¿verdad? Toda familia, tenemos necesidades o tenemos personas que tienen ciertas condiciones de salud mental. No todos tenemos este privilegio a veces y incluso los que nos decimos sanos mentalmente tenemos dificultades o tenemos nuestros problemas.
Like an example, this project, I feel it's a good idea. Always in the society, there's families that have these necessities. There's people that have health issues. And even us, we could be fine one moment, but then we could just have some health issues ourselves as well.
Uh-huh. Tradicionalmente la locura nos espanta, nos asusta, nos da miedo, ¿verdad? Porque pensamos que estamos expuestos generalmente a situaciones de las cuales no podemos tener control.
And
¿sí?
Traditionally, trying to being labeled as crazy or something, that could be scary because that's something that we're not kind of used to.
Uh-huh. Y entonces nos entra el pánico, ¿verdad? ¿Qué va a pasar? Generalmente lo asociamos con peligro, con suicidios, con muerte, cuando muchas veces lo que estas personas necesitan justamente es un entorno en el cual puedan ser entendidos y puedan ser tratados adecuadamente.
And then sometimes we just start thinking about panic, like, man, what's gonna happen? We start getting scared. We start thinking about death and suicide. But really, what these people need is like an entrance, like somebody that could kind of understand them.
Así como están las prisiones, que bueno, lo están comparando mucho con esto, pero ¿cuál es la ventaja de una prisión? La ventaja de una prisión es de que todos los delincuentes están en un centro atendidos por profesionistas, personas que saben cómo cuidarlos, cómo atender todas estas situaciones de conducta con estas personas. Lo mismo sucedería con este centro de salud mental. Ahora, las personas, el personal que se contrataría es personas especialistas, así como tenemos maestros, psicólogos, trabajadores sociales en una escuela, en un centro de salud mental también se cuenta con personal especializado, psiquiatras, psicólogos, terapeutas de salud mental, terapeutas ocupacionales, que precisamente es para atenderlos de manera adecuada. Que tienen crisis, sí, como todos lo llegamos a tener.
And the thing is, like we talked about prisons, we compared them, the advantage about having prisons is that, they're in the center, there's professionals that work there. They're getting the help that they need by specialists, people that know and are able to deal with prisoners. And in the other hand, if we have this center of behavioral health, there's also going to be specialists there that are going to be helping them out. Just like in schools, we have psychologists, teachers, but on this behavioral health center, there's going to be psychiatrists, psychologists, OT therapists. There's going to be people that are going to be able to give the adequate help when somebody's having a crisis.
Entonces, yo diría mi opinión es que no nos asuste contar con un centro como este en su comunidad. Yo creo que de repente sería un poco más complicado que estas personas con estas condiciones de salud mental no tengan una atención adecuada, que estén en la sociedad también, están como nuestros vecinos. Y si le tenemos este miedo a la salud mental, pues creo que es mejor que cuenten con un centro en donde puedan ser atendidos de manera adecuada.
And my opinion is that, don't be scared about centers like this. Maybe in the beginning it might be complicated, but it's going to be in place where they're going to be getting the attention that they need, in the society. Yeah, they are going to be our neighbors, but don't be scared about this behavioral health center.
Señora, disculpe, si le podemos pedir por favor que termine el comentario. Ya tenemos tiempo.
Sí, perdón. Entonces, bueno, lo que yo opino es de que a lo mejor las dudas que tienen los vecinos, y con justa razón creo yo, es el proyecto de entrada están haciendo con un déficit. Creo que es de entrada algo que tienen que ver, ¿sí? Ustedes mismos lo están visualizando, hay un déficit. Creo que darle la seguridad a los vecinos del personal que va a estar al pendiente o al tanto de este centro y en este caso pues los vecinos, yo creo que si ustedes también les dan la seguridad de que el proyecto va a ser seguro para ellos, creo que es lo que ellos están pidiendo, seguridad.
The thing is that my opinion is that, I know that there might be a deficit, first of all, for this project, but I think what the neighbors just want to hear is that this place is going to be secure. Just making sure that you guys tell them that your staff is going to be taking care of the center and that the neighborhood is going to be secure and this project is going to be a safe project.
Yeah.
Gracias.
Hi, my name's Dolores Valdivia. Sorry,
Yes, you're next.
Okay. Okay. I have gone to the Board of Supervisors meeting. I come to 3 listening sessions. this is my last one. My question, I have two questions. Are you going to have another listening session before the January 6th meeting? Also, because the facility is like the one in San Mateo, what is their success rate? What is, has anybody tried to break out from there? Also, I'm totally not against it. I'm against where it's at. I think that there's a new hospital or the old hospital that could be used. I think, again, with Tina Nieto doing that, not good. I have heard about this project probably about a year and a half ago. I live on Atherton, but my fence line is right there. So I'm very concerned about it. But I am going to say this, all this energy that everybody has, you need to take that to the Board of Supervisors. You guys are doing a job where you're listening to us. Everybody's coming at you. And they have these questions. But that energy needs to go to the Board of Supervisors. The three of you are not going to decide. They're going to decide. You are listening to us, and I thank you for that, because it has been rough at times for you guys. So thank you for that. And please, all of you, go to the Board of Supervisors meeting January 6th at 1:30. I have to take off work. I'm going to do it. I will be there because it's important to me. So if it's important to everybody else, be there. Show up. That's it. Thank you.
Don't wait for January 6th either.
Thank you for your comment, and yes, again, the next Board of Supervisors date is January 6th on the afternoon calendar at 1:30.
Okay, I don't think anybody here is against helping the mentally ill. I think what we're opposed to is where you want to put it, and that is in a family-oriented community. You can't do something like that. It's absurd, and it's absurd. It really is absurd to be putting this safety issue in a community like that has so many children in it. I mean, think about it. Are you thinking, really? Are you thinking with your heads? I mean, we're not opposed to having a facility for mental ill people. We're opposing where it's being placed. Period. That's it.
Thank you for your comment. We are going to shift back to Zoom. Sorry, I missed it last time that there was a comment on Zoom. Go ahead.
Yes, we have a couple comments from Abel in our Q&A. One, traffic will get worse once the new housing begins construction. Has that been taken into account? Two, why not put this on a ballot so that everyone has an opportunity to voice their opinion? Three, not opposing mental health facilities, just opposing this facility being built here. Why not give your financial resources to another county so that they build the facility there? Four, you said you're trying to serve your community, but yet you're going to accept outside patients. Why not build it in another county?
So there was a comment about the traffic, so I'm looking to Luis again to answer the first part of that question, which was about traffic.
Thank you, Luis.
So I actually have an answer to that very first one, because we have been considering all that. So as part of preparing the traffic analysis, the consultant actually asked us to look at all the nearby developments of significance. And so that includes the brand new park along, I think it is Natividad, right by Posada. We have had to consider, the north part of the city of Salinas that will be growing. We had a meeting with the city of Salinas and requested to be made aware of all of the big developments that will be bringing traffic that could ultimately travel through Constitution. And all of that is getting baked into the traffic study. So we're not only considering the impacts of our projects, but we're considering the impacts of nearby and future projects, within close proximity to ours. So that's the answer to that question there.
Luis, don't go away. Luis, I got a question for you. Hi, Jose Guerra, Montebello Community. Luis, why isn't traffic calming here? They should be here with more information on how many vehicles will go through there, or have they put any monitoring devices down to see what we have now compared to what we'll have once it's built? Thank you.
The answer to that is yes. We have already collected data. There was a traffic count done at the peak times. So that's in the morning, I think between 7 a.m. and 9 a.m., as well as 3 and 5. And we actually did some extra work. We ended up paying the consultant a little extra to do a traffic study during the weekend to understand also, you know, how our project relates to the vicinity, right? The hospital use, the Salinas Regional Soccer Complex, and that's a little something that we went above and beyond what we had to do, but we wanted to do it because we wanted to be cognizant of the impacts of this project may have in the neighborhood, and we wanted to address those as we develop the final traffic strategy for this project to avoid, you know, traffic impacts to the neighborhood.
Do you have a number, Luis, more or less? A number, a proposed number of what the impact will be? 500, 300 more cars?
I mean, I don't have the report with me. Those reports are highly technical, and probably the person that will be better suited to answer that will be our traffic engineer. I am not a traffic engineer, so I'm not going to try to answer that. But I think the kind of important numbers to mention is kind of like what I explained in the, you know, when I was asked the previous traffic question. Really, the numbers that this project will bring is really the staff that will be, you know, making all of this campus operational. That's really the traffic that this project will be contributing. I think, you know, there's other uses that probably have higher use than this project will have. So, yeah.
Thank you. You know what? Can we move on? Because we have other members of the pub. I know. So, sorry, Mr. Jose. The last comment was in person, so we'll take one on Zoom, and then we'll come to you. So you can stay at the podium. That's okay.
We have a comment from iPhone 67. Take it back to the board to discuss the old jail. It really should be an open discussion. It's a good compromise to the community already an old jail and cost less tax dollars.
Thank you for your comment. Okay, we'll go back to the room.
Hi, everyone. My name is Isabel Quesada. My husband and I have been living here in the community for almost 40 years. We have been living in Creek Bridge area. I'm a provider. I have a daycare at home. I have been in business for 26 years already. I'm very concerned about this proposal of building mental health facility. I'm concerned about the homeless and the river too. Most of the times when I moved to Creek Bridge, I used to walk with my children, with all the children that I take care. It has been like 10 years that I don't walk with them no more. Why? Because it's not safe. I serve families, very good families, wonderful children. We have a beautiful environment. I want to keep that environment how it is. I'm concerned about the homeless. I'm concerned about the new building that they're trying to build. I'm not against it, but I'm against the location. I encourage you as a parent, you know, I ask you this question to the three of you. Would you like to have a building like this close to your neighborhood? Just think about it. We work hard. And it's, like I said, I'm not against. I know it's a lot of people that needs help, a lot. We have families that need help. I'm only concerned about the future for our children. Thank you.
Thank you for your comment. Marty, is there anything online? Okay, back to online.
We have another comment.
So we had 3 minutes per person. Let some other people speak.
I don't see anybody.
We have another comment from Able Online.
Let's go back to online.
So knowing all the future construction in the area, you guys are still willing to overcrowd this community. Doesn't make sense.
Thank you for your comment.
I have a question. I did remember that they had mentioned that this building of was going to be at the old hospital. What happened with that? Because I kind of missed what happened between having the old hospital and then this. That was. Can you answer that question?
So just to clarify, it was not going to be at the old hospital. It was initially, the proposal was to renovate the rehabilitation wing of the old jail. So it wasn't the old hospital. And who joined? Chief Deputy Landquist, I believe, joined the last meeting and was able to speak that to the jail needing that for their own internal operations. And so they were not able to, we were not able to move forward with that initial plan. Anything else online? Back to online? Nothing online. Okay. Back to the room.
Margaret setting up an Eddie. I do want to reiterate what was said here earlier. I've been passing out these flyers. They're employees and they want this project, but they don't have the final vote. The final vote is with the County Board of Supervisors. You need to be calling Chris Lopez, who is the chair. You need to call our representatives, who are Glenn Church, who was here. Thank you to Glenn. And you need to be calling Luis Alejo. You need to be calling Wendy Eskew. They're the final votes. Now, I will tell you that after watching those meetings online, after coming to very late notice on these meetings and watching, yes, you were chastised in front of the county board. And one of the big area was the fact that you had not done any public outreach. You admitted to us here in this room why, because you didn't want to hear basically what we had to say. Okay, smile, but you rolled your eyes that day at us. And that's disrespectful. We're not here to disrespect the people with mental health issues or have psychiatric problems. That's not this community. That's some other community. It could be the communities you live in, but it's not this community because this community lives next to a juvenile hall, a county prison, a warming shelter, and a hospital. So that's not this community. So let's just get off that right now and stop trying to pit us against, like Rosa here's loved ones, because that's not this community. What this community is saying to you is let somebody else do their share. Maybe you can go and go around your own neighborhoods where you live, go around and say, hey, how would you like this? And then you can come back and report to us at the county board what the people in your neighborhood had to say. Maybe Tina can do the same thing in Pacific Grove and ask her neighbors, how do you feel about this? Because I'm the sheriff and I need this. How do you feel about put this in PG? And let's see if they don't drown her in the river, okay? Because that's the way PG is, and that's the way Big Sur is, and that's the way Las Palmas is. And people call in here and they have the gall and disrespect to call this community and say, we think this is a great project because I work at the hospital, I drive home to Las Palmas. They need to keep their opinion over there, or they need to be in advocating for, we'll take it. But we're sick and tired of you guys dumping on this community of farm workers, middle class, hardworking people who have made their homes here, knew when they came here that this is where they were moving, but they didn't expect to become the social services of California. And it's not because we don't believe in social services, but when you do this to one community, you create blight. And this has been a state project that has now turned into a panoptic project like Pelican Bay. Those people, they get locked up. Let's not pretend with your slides that this is a community that is going to be, they're going to get to walk around, take their dogs. We have kids at the soccer fields. They're not happy about it. They haven't been informed. We just want to say enough. And, bringing the city manager to talk to us about stuff at the last minute is disrespectful because we know our problems. We can't even go to Safeway at night. We cannot take walks along the river anymore. The kids don't go on field trips anymore. The people, as you heard somebody who does daycare, they themselves don't.
Yes.
Because
there's other people
because you
behind
have allowed others to go on and on.
No, so
But you know
can
what?
have your 3 minutes, Miss Margaret, and you can come back up, okay?
Well, it's Margaret, not Miss Margaret, okay?
Thank you.
But yeah, I will come back up.
Let's just have you come back because are you two waiting to come up?
Does anybody have a problem?
Well, they don't seem to have a problem.
Okay.
And you know, I respect you, Rosa. She's had 3 shots at it, okay? And our city council member has had a couple of shots at it too. So let's not just shut down the people you don't want to hear, all right? Unfortunate, you may not want to hear it, but you got to hear it. I have listened to these meetings. They told you to stop spending money because it's already ballooned. You don't have the money for the infill. You're talking about a $172 million project, which once interest starts getting paid on your loan, it shoots up to $300 million. You first came to them with a proposal of $800 million, okay? And so that's all taxpayer money. We need to realize that that's all taxpayer money. If you take those numbers and you look at the amount of people you're talking about servicing from the local 49, what does that come out to? Like, if you're at 172 million, that's like 2-point-something million per patient. If you balloon it up to 300 million, that's like 7 million per patient. I'm sorry, but that is just overblown, overthinking at a time when we have an administration which is pulling dollars from California because he just loves us. You have no guarantee on any of this funding. Even the funding coming in these grants come with provisions. You haven't done CEQA. You haven't informed. You know, you said you were required 100 feet, and you did 300 feet. So who is within that 300 feet? County jail, juvenile hall, and a couple of residents along the way. The rest of us got so disrespected. And yes, I'm going to tell you because you guys are the ones pushing this project, but you don't have the final say. And we all know that you don't have the final say. You yourselves have been put to task for not doing the work properly and thinking that as long as you kept the meter running and spending more money, which you told us yourself at the last meeting, which have you released that video? Have you released the first meeting? You haven't. Why? Why haven't you released? It's public comment. People were here in this room. They had a lot of things to say. You haven't released it, but you're required to. You're required to, okay? And so you are just greatly disrespecting a community that has made their living here. And it's not, you know, when people talk about the cost of their housing, it's very important because that's the same equity they use to educate their kids, to educate their grandkids, to put them in school and have a hope for a better future. You're not respecting that. You could put the same project in Las Palmas. Would you see the needle move on the value of their homes very much, if at all? Would you? But over here, it's going to affect everything from what we pay for car insurance, because crime rates are up. There was just an article about the crime rate up in this area and how many people that have been out there breaking into cars. There's the whole encampment behind Safeway. So it raises our insurance for our housing. It raises our insurance for our cars. It raises everything. It raises our blood pressure. So if you're speaking about mental health and you're talking about 49 patients who are getting care already in another county and getting top service, you're creating more patients here because you're stressing out a community who is already at wit's end, who already, many of them have their kids living in their homes with them because they can't afford housing. And now you want to just put more on a community that is already overstressed.
So thank you for your
Call
comments.
your board members.
We're going to move on. Is there a comment online, Marty? No. Okay.
So we can because we have our interpreters here and they on a schedule, we could probably keep them for another 10 minutes if that's okay with the rest of you. We want to make sure if you haven't had a chance to speak that you get that opportunity. Sound good? Okay, we'll go for another 10 minutes. Yes, you may.
Here I am again. You know, listening to forums like this is absolutely marvelous, you know, and getting to hear the perspectives and listening to individuals, even the gentleman with the mental health art. I wish I got to get his name.
Can you please speak into the mic?
I wish I
We
got
can't
to
hear
get his
you.
name because I'd be interested in hearing. But again, I'm not here because of a mental health facility or your need or Salinas's need for the mental health. I'm here because the mental health facility is going into my backyard. And I don't think you guys understand the implications when I say that. That block wall fence is their walking path. That is my backyard. We haven't even talked about, I mean, I've talked about money and percentage because that's what seems to be the effect on most people. But now when I'm actually listening, it's more about the safety concerns. So, I mean, even the safety concern drops just having these conversations for our neighborhood, what we've just brought to it. And again, like she said, you guys aren't the all to be all. You're trying to sell a timeshare to our community for another community. Admirable, okay? What about the light pollution in my backyard? Took me 11 months to get Natividad to change their lighting system in their portable parking lot because it shined in my back lot, my window all night long. But nobody seems to really care about the simplistic things in life. We seem to care about, hey, is this a blight on my community? I came to the board of directors one time because I wanted a chicken in my backyard. They told me it was a blight on the community. Voted it down. But you wanna, I have to go back to the city of Salinas wants to spend hundreds of millions of dollars, ladies and gentlemen, on a project they have no funding for. They're expecting the federal government to fund it. Well, it's coming. They're waiting for the federal government to fund the majority of this backing. They're talking about maybe your daughter, nephew might get to use the facility. Might, if the bed is there and your insurance meets their criteria. God bless y'all, because you got a hoe road to hoe. The fact is this is not benefiting a community. I've listened to folks, and this is my community. I watch the homeless walk up and down my street. I hear it all. I see it all. I have to walk my dog, a German Shepherd, with me because I don't feel safe. Now we just introduced another ginormous albatross on the city of Salinas to support. And it's not you guys just supporting it. It's my pocketbook. It's his pocketbook. It's her pocketbook. And yes, go to Elise Jimenez on your piece of paper. You look and see, she is the director of behavioral health. They have a folk in their back pocket. Where's ours? You know, these are the people that we need to talk to, not you guys. And I apologize. But thank you, yeah.
I am Elsa Jimenez, and I'm not the director of behavioral health. I'm the director of the health department.
You have somebody in your pocket on the board of directors. We don't.
So thank you for your comment. We're going to go back to Zoom.
We have a comment from Abel. I don't remember the lady in the middle of the panel last time. She stated that she lived in Prunedale next to Manzanita Park. Why don't you advocate to have this infrastructure be built on Manzanita County Park property? Patients will have fresh air and better scenery.
Thank you for your comment.
So
Now,
back to the room.
Am I ready? Yes. Okay. When we, one of the first, I think it was the first meeting, you said you were mirroring this complex to San Mateo. Is that also Redding, or because it's right in between? Anyway, I looked it up on Google Maps.
No, it's the Cordilleros Mental Health Rehabilitation Center, which is a building facility like the one that we're modeling after.
Okay, and they're in the middle of an industrial area. There's apartments there, but there's no children there, right? I looked it up on Google Maps. So I saw the facility from the sky point of view. There's apartments, but there's no children. It's all industrial, which I thought was a great location. So we're not mirroring them. What is the success rate of this mental health? And I'm curious because when Sandra called in about the house that she lives in and the mother that got killed, that person that did this crime continues to write letters to that home. That's dangerous. He knows where she lives. He's asking for his mother because he doesn't know where she's at. And he's in one of these types of facilities. Now, Rosie, I think her name was, she said something, Rosa? She said something about health and drugs is totally different. It's not. It's all in one, because this person was doing drugs, but they sent him to a facility in Fresno just like this one that you want to build. How does he have authorization to write to that house looking for his mother? Is he going to be one of the ones that you're bringing back to here, to Salinas? Okay, so that's that point. The other thing is, I wanted to give you some locations. This is the wrong location for this facility. It is the wrong location. There's North Natividad, if you must put it here in Monterey County, but I agree with someone that said, find another county. If there's no room here, because we're overpopulated in Salinas, find another county. Don't do it here. I know the goal was to bring the other people, to bring in money to Monterey County. That was the plan, that was the spill. Move it to another county. We're too crowded here as it is already. But there's also North Natividad, where they're going to be building all that housing. How about John and Abbott, where they were going to build a softball park? How about KSBW, right there on John Street? That's a big land, and I never see any cars there, maybe 3 or 4 every day. And then, of course, there's South Monterey County, but I think you should look at other resources, because it does not belong here. It's too populated, too many children, too much danger. And it's not that we don't understand, that we get scared because of the mentality. It's just, it's not the right location. Thank you.
Thank you for your comment, and I just got notice that the interpreters, I think we ended our time with the interpreters.
So we'll just take one last comment then, because we wanted to make sure that this was a bilingual town hall. So this will be our last comment for today. Thank you.
Can I need to have one more wrap up before he's at 3. Other people have had several.
Oh, I'll give you some of my time. I'll give you my time. Give me 1 second. Okay, once again, good morning, or good afternoon now. Jose Garamond Villa Community. I want to say that transparency is the most important thing. Please be honest with your constituents here. Let them know that stuff can happen. Stuff can go wrong. It's okay to say that, because it might happen, it might not, but it's good to be open about it. Once you do that with the public, you'll have a different outcome with them. I learned that because my old career I had. Be transparent with people. Once again, I agree. Let's put it on the ballot. I said that for many things. Put it on the ballot. Let the people decide, not the Board of Supervisors, not the City of Salinas with the rent control thing they have going on. Why? Put it on the ballot. Let the people decide. The people here can vote on it. And if we lose that way, at least we lost honestly. You know, and everybody had their choice. And another thing, on public comment, no disrespect to you guys up there. God bless you. You guys are getting beaten up like crazy. But don't limit public comment. Let people vent. Let people know how they feel. They need to express themselves. When you don't live in that community, it doesn't affect you. And I hate to say that to anybody that doesn't live there. I don't live there. But it affects me because a lot of my friends do live there. A lot of the people, Yolanda's dear to me. She lives there and she tells me about it all the time. I feel for her. Do not limit public comment. Don't be like the City of Salinas. Don't be like Mayor Donahue. No disrespect to him, but limiting public comment, no. Let people speak their mind. You'll get more results that way. That's it. I'm going to give her my time. Go ahead.
Thank you.
Margaret?
Actually, I'm going to take my time, but thank you.
You're welcome. Take mine and yours.
You heard that. His and mine. Again, Margaret setting up an Eddie. First, I'd like to also point out that there are county employees who have been interfering with people who are out in the community. They've interfered with myself. They've interfered with Yolanda. I know they've interfered with others that are literally cutting into conversations with stakeholders. And I don't know, one person said to me, well, that's the county. I work for the county, so you need to tell your employees just to back off. This is our community, and we have every right to talk to other stakeholders about this project. And those stakeholders make up their own mind. But to have people literally get in between when you're talking to a business owner is just not the right thing. No employee should be doing that. So I wanted to say that. I also wanted to talk again about how this was a bait and switch from the county jail, and it was never agendized properly. It started out at the county jail, and then when you guys got a resolution to do it at the county jail, a go-ahead for looking into the project from the County Board of Supervisors, that's what they gave you. That was the assignment. You guys went off into the Wizard of Oz land, and you came back with something else. You basically said, oh, we changed our mind. We're going to use this resolution permission, and we're going to start this other big project over here without properly agendizing it, and you were called out by Luis Alejo on that. I looked at that posting, which violated the Brown Act, because nowhere in there did it alert anyone in this community as to what was going to happen. If it had, there would have been more people in there to voice their opinion. Instead, when the chair called out, is there anyone in the room? Well, there was no one in the room because the way it was placed on the agenda was all very stealth, purposely. Nobody does. Anybody who knows about the agenda of the Brown Act know what they're doing when they leave a whole community out of the discussion. And that quells our free speech, which is a lot of the problem here. Again, I'm going to say this is not your decision. They want to give you the impression that it's a done deal. They just want your opinion on what it's going to look like, the paint color. What is this place going to look like in 30 years? It's not their final decision. It is the final decision of your elected officials. That's who it is. And I can say that you guys took them by surprise too. Again, anybody who has watched those meetings, all they have to do is watch those meetings to see how you guys kept pulling a rabbit out of a hat in order to justify where you were going. Spend more money, spend more money, spend more money. So, Ms. Jimenez, as you said, you spent a lot of money, so therefore it's got to get approved. No, it doesn't. That could come out of your health budget, okay? But this is not a done deal. Let's not let them tell us that it's a done deal. That's how they want you to think. We just want your opinion. No. I've had business owners tell me how it's impacted their businesses. And so it's not just about, it's not just about the whole mental health thing. It's about too many projects in one area. I've had business owners telling me that they're losing business because they can't get people to come into their establishment because they get accosted or it's unsafe. And so you're just adding more of that blight. And with funding that's just not even there, period, it's not there. And for you to go say we're going to go beg the rich for money for this project is more of an insult to this community. What are they going to get out of it? Their name on the side of the building? Name the ward after its particular. You're going to go beg the wealthy for money so that you can come dump on our community? I'm sorry, but that's even more disrespectful. You need to put a stop to this. You need to realize, when something is ballooned over and a failure is a failure, you need to just accept that this community has pushed back on you hard because you never respected the community to begin with. But had you done that from the very beginning and been told no, you wouldn't have spent so much money, time, and effort on something that you already knew you were going to get a pushback on.
So we want to thank everybody for joining us in person and online. We appreciate hearing your thoughts about this project. And again, the next Board of Supervisors meeting where this will be presented will be January 6th at the 1:30 time slot. So thank you, and we hope everybody has a good rest of your weekend. Thank you, everybody, for coming.